Hello, everyone. Welcome back. Hope you had a great break. So now we're going to go ahead and jump into our local prevention panel. This was actually a highlight of the 2019 CADR Summit, where we sort of had an expo and we had local committee leaders present their different initiatives in the back of the room. They were able to give like a hands-on presentation and whatnot. So we're going to try to emulate that as best as possible on the virtual platform. But this time it's going to be through presentations. We do hope that you all take home some meaningful tips and best practices as you work to implement these prevention initiatives in your communities. So our first speaker today is Vicky Whitfield. For the sake of time, I won't be reading the bios in their entirety. However, I will provide a brief introduction for each of our speakers today. Their bios are included in your summit packets, and if you did not receive a hard copy summit packet, we can send you an e-file of the summit packet as well. So Vicky Whitfield is she's the chairperson for our circuits 4 and 7 local CADR committees. This covers the Duval area and surrounding counties. Vicky has been a leader in CPT and in CADR for several years, and it's definitely a pleasure to work with Vicky. Today, she will be talking to you all about Sleep Baby Safely campaign, which was it's a campaign that was actually developed in Pinellas County and then replicated successfully in Duval County. So Vicky will be providing information on that today. Thank you, Vicky, for joining us today, and I turn the floor over to you.
Okay, thanks, Josh. As Josh said, this initiative was started in Pinellas County, and with their permission, we were able to take a lot of their information, a lot of suggestions and tips from them, and make it into our Duval initiative. We started the initiative effective on January the 1st of 2020, but we started preparing for this initiative in September and October of 2019. Finding out that we were Duval County was leading the state in infant deaths from unsafe sleep in 2019, or well, 2018 and 2019. The program office was able to help us obtain the materials to start this program to help us see if we could get the number of deaths reduced. When we started, there's a lot that you have to do if you're going to do this initiative. It is a lot of work, but it can be done. After we decided we were going to do it, we had to find a large building to store a year's worth of materials, and also space to have volunteers come in and do the packing and boxing up bags and getting ready to make deliveries. So what we did was we went to DCF, our local DCF. They have a large building on their property that they were not using at the time. And they said, yes, you can use it free of charge. So we were able to go there knowing it's on a property that's pretty much monitored. So it was not, safety wasn't an issue. And we were able to store all of the boxes and materials there, but it also has a large room that we were able to have volunteers come in to help pack bags, box up bags, and then once we were ready, the bags were packed, we still had rooms that we could put them in. So we were able to make this a one building that we were able to do everything in. After receiving the materials, which was like in September and October 2019, we scheduled volunteer days. And initially, I kept thinking people were not going to volunteer. It was just going to fall back on a few of us. But actually, we would schedule Saturdays where people were not at work. We would schedule for about 4 or 5 hours, kind of not real early in the morning, but mid-morning and then into the early afternoon. And that way, people still had free time. And we would have them come in. We would have groups. I think the first one that we did, we had close to 80 volunteers that showed up on a Saturday. Other days that we did, we would have anywhere from 25 to 50 people show up. And we would get the word out that we needed volunteers through our CADR members, through our local, through our other community partners like DCF, Family Support Services, Healthy Start, Healthy Families. Everybody would just get the word out that we needed volunteers and what the initiative was about, and we had them show up. we did the volunteer days. I would say that we probably had 5 or 6 Saturdays that we had volunteer days on before COVID hit, and that kind of ended the volunteer days. But we started doing that. We had CADR members who volunteered. We had DCF staff, other, like I said, Healthy Families, Healthy Start, Family Support Services, the health department, local health department. We had high school students come in because they need volunteer hours, and they, this is something that they could come in and help with. We had nursing and social work college students coming in from UNF and JU because they also need volunteer hours for their degrees. And then we had what I call community service groups, like your Rotary, your Kiwanis groups, your Eastern Star groups. They would also come in and help us. So pretty much by January of 2020, we had, I would say, half to 2/3 of all of our bags for the year packed, and they were ready to be boxed up and delivered. We made the decision as a group to deliver to the hospitals monthly because they did not have storage space. And even though it put more on us as a group of doing this, it was just, we want to work with the hospitals, and it was just easier to do it that way. In December 2019, our group started doing trainings with the different hospitals. Now, in 2020, we had 9 Duval hospitals, birthing hospitals, that we were delivering bags to. So we went out to each individual hospital. We met with the L&D nurses, the supervisors, we met with the NICU staff, and we met with the lactation specialist. And there's a PowerPoint attached, and the first page is up. We'll go through it at the end. But we presented the education to the nursing staff and to the lactation specialist and the other staff that we wanted them to deliver to the parents. Now, I will tell you, it was very challenging to get all the hospital staff that we needed to train. So what we were doing was going to the hospitals at 6:30, 6:45 in the morning. We were going at 6:30 at night because we were hitting the nurses at shift change. That way, they were coming off shift, they would come in the room, the training presentation was anywhere from 20 to 30 minutes, and then they were ready to go. Or we would catch them before they went on shift. We learned that to be able to get them without putting extra stress on the nurses, we wanted them to work with us and wanted them to be excited about the program. So we did what we could to make this as easy as possible. In December 19, we asked each hospital, December of 2019, we asked each of the hospitals to estimate the number of bags that they would need monthly. We told them we wanted every baby that was born at that hospital to have a bag, and the parents or caregivers to be educated at the time of discharge. So they would give us a number, and we would deliver that number of bags to the hospitals. We've continued that on. Even now, each month, I'm contacting our person at each of the hospitals that we're working with and saying, okay, guys, we're getting ready to make our delivery. How many bags do you need? And that's what we deliver. Now, if by chance they are too low on their numbers and they need more that month, all they have to do is get in touch with us. We make a, another quick delivery over there. If they have too many, they don't deliver as many as they thought, then they just cut back the number of the next month of what we have. I can promise you that the bags are being used. After we got all the bags packed and ready to make the deliveries, we got the education done at all of the 9 hospitals. We started effectively January 1st of 2020 so that each parent caregiver was given the information, and then also there was a bag that went home with each baby. And when we decided what we were going to do is, even though we have babies that are born that live out of Duval County, we did not want to say, oh, well, you don't live in Duval County, you don't get a bag. So if the babies were born at the hospital, the baby and their families got the education and got the bag. If we had a mom that had twins or triplets, she got 3 bags and they still got the education. We want to make this a positive for not only the nurses, but also for the families. Starting in January, in January 2019, we had the most across the state of Florida infants that had died. Starting in January 2020, our numbers have significantly declined. Now, when you're starting to do this, you want to make sure that you're looking at the effectiveness of the program. So like in Duval County, we have 9 birthing hospitals, but we have babies that when their death happens, we're finding out that they may have been born in a different county. We have, we're close up here, so we have babies that are born in, I'll say, Clay County at the hospital there, even though their family lives in Duval County. We have babies that have passed away from unsafe sleep that were visiting from out of state. They were visiting from a distant, coming in visiting relatives, and they die. So we tried to look at the numbers. We look at the overall numbers, but we're trying to look at the effectiveness of our program to see how well it works. So we have to kind of separate our statistics that we get. And we take our statistics from Florida charts, and then we also take our statistics from the data that we enter into the national fatality system from our cases that we review. In 2019, the babies that were born in 2019, but they died in 2020, and the parents did not receive the education because we were not doing it yet, we had 12 babies die from unsafe sleep. The babies that were born in 2020 and died in 2020 and the parents did get the education, we had 6 that passed away. The babies that were born in 2020 died in 2020, but they were born from out of state, like the one that I'm thinking of, the family was visiting for the holidays. They didn't have the education, so you can't really put that in your numbers. And then the babies that were born in 2020 and died in 2020, but were born out of county, specifically Clay County, St. Johns County, because that's the hospitals that are closest to Duval, they don't get the education. We had 2 of those. Then we looked at the infants that were born in 2020 and died in 2021, and the parents received the education. We had 2. The babies that were born in 2020 died in 2021, but the born out of county, with no education was 1. And then the babies that were born in 2021 and died in 2021, and the parents did receive the education so far, was 3. So kind of as a synopsis, from January the 1st of 2020 through June the 15th of 2021, we have had 15 infants born which have died from unsafe sleep environments. Out of those 15 who have died, 11 of the families had received the safe sleep education and 4 of the families did not receive it, as they were not born at one of the Duval hospitals. Even though 11 seems like a lot for one county that we're doing the education in, when you look at the previous years where Duval County had anywhere from 20 to 25 to 26 to 28 deaths a year, we think we're making progress. We think we're making a significant impact on the number of infants that are dying. We're reducing that number. We know that we're never going to be able to stop it totally because of the 11 that had the education. Some of the parents will look at us and tell us, I've always slept with my children and I'm going to continue to do it. We're never going to change their mind. Some of them would say, I was exhausted. We knew better than to do it, but we put them in the bed with us anyway. We have moms that are breastfeeding and they're putting the babies in the bed with them to breastfeed and they're falling asleep while they're doing that and the babies are smothering. We know we have a long way to go and we're kind of changing. We kind of got this down to a fine, to kind of how we're doing things. So now we're kind of expanding out to how we can do things to let to hit the families that are still sleeping with the babies. We're wanting to give information to the pediatrician's offices, to the WIC offices, to the immunization offices, to the OBGYNs for them to do education with the moms. Because even though they're getting the education and we're catching the majority of them, we still have some that we're missing. And I kind of look at it as if you lose one, one's too many. So we're expanding our program out. It is a lot of work. To sustain it, you have to have funding. Like I said, the first year, the program office helped us with the materials. We didn't have quite enough for our first year, so we had some personal and some business donations that was made to us. And then we also got funding from our Healing Hands Foundation, which is, they work with us through our local CPT advisory community board. And then this year, after getting about a year's worth of numbers, we approached the Kids Hope Alliance, and that is an organization through the city of Jacksonville that funds and works with social service programs and programs that benefit children. And they're in the process, I think actually we've already gotten it done, of entering a contract with us to assist us with funding and volunteering for the rest of this year and also through 2022. So we're hoping to continue this initiative. We think we're making a difference. We think it's a great program. We have the hospitals on board. They love the program. They're very dedicated to it. We're going back in and continuing to do training with them to keep them going. The only thing that we really did differently was at the end of 2020, we have 3 Baptist hospitals, and then we have 6 other hospitals. And the Baptist system decided they want to do a safe sleep program, but they wanted to do it differently than what we were doing. They wanted to provide different items. And so they kind of pulled away from our program. They're still doing something and we still communicate, but we're only working with 6 of the hospitals now. We work with 2 University of Florida hospitals, 2 St. Vincent's hospitals, Memorial Hospital, and then we also work with our naval base hospital. NAS Jax they deliver, so we work with them. We hand out, as education-wise, we give out the tip sheet, Safe Sleep tip sheet, and then we also give out a bag. We give out a little onesie that says "This side up." We give a night light that has the ABCs, well, alone on your back and in the crib. And we have little plugs that we give out that has the same little logo on it. And then we also get the books from the Charlie's Kids Foundation, Sleep Safe and Snug, and those go into the bag. And when the nurses meet with the families, what we ask them to do is we don't put the tip sheet in the bag, because then we know it would be so easy for that nurse who's really busy just to hand that to the parents, and out the door they go. So what we do is we give them the tip sheet separately. We give them the bags folded up, and we give them the tip sheet. And we ask them to sit down, talk with the families, go over the tip sheet with them, answer any questions, really spend time with them, and then put that in the bag and send that with them when they leave. And like I said, the families seem to be very excited according to the feedback we get. The families are very excited to get the information. The hospitals, the nurses are very excited. Everybody feels like we're doing a good job. With the 11 children that we had that died in 2020, just to kind of give you an idea when we were talking about the deaths, and this is provisional because this comes out of Florida charts, and 2020 numbers are still provisional. We had 12,490 babies born in Duval County in 2020. In 2019, we have 13,032 babies born. So we feel like that, when you look at those numbers, we are making we're making a difference, but we're not where we want to be yet. We really want to be able to get this information out, what I call kind of saturating Duval County, to get everybody in the medical field and the social service field on the same page, that we're giving the same message, which is the ABCs of safe sleep, alone, on their back, and in the crib. And that we're getting it out in the community, where we have community members that are also meeting with families and talking to them about it. We have fire rescue and law enforcement that has had training on this. They're going out on calls. They're talking with families about this. We have the social workers, the DCF and the service, the caseworkers. They're going out. Everybody's giving the same message to all of the families that we're dealing with. And we seem to be making a difference with it. Ken, if we can move the slides forward. This is the Safe Sleep Baby Safely campaign that you're seeing on the screen. This is what we used when we were training the hospitals. This was our objectives with them, which is talking about the facts and the data about the sleep-related deaths, teaching them the way that we would like to see babies sleep safely, and then discussing their roles. And this is basically with the nurses, with the and nursing directors, the supervisors, the lactation specialists, and then, like I say, we also do the training with the NICU, because you have babies born that then end up in the NICU, and we want them to also be giving the same information. This was preventable deaths. This was when we first started. We did this PowerPoint, and preventable deaths by the type from 2014 through 2018. And as you can see, the sleep-related deaths are in purple, and then the injury, all deaths was in orange, and then the drownings, which is our next leading cause. And you can tell that in each of those counties, each of those years, we had a good number of deaths from unsafe sleep. Can you go to the next one? This kind of just gives you a different preview of it. 2014, we had 16 deaths from unsafe sleep. 2015, we had 20. 2016, we had 26. 2017, we had 22. 2018, we had 27, which right there for 5 years was 111 deaths of infants that were preventable. And then I know in 2019, I believe we had 28 deaths also. So when you go from 28 deaths in 2019 to 11 that had the education in 2020, we feel like we've made good progress. Next slide. This was just we wanted to see what the birth rates were for race, and also the death rates. So the African American is in blue, the Caucasian is in orange, and then other, which is most of the time with us, that's Hispanic. And we do have some Chinese, I believe, in there also. Next rate. We kind of divided it into our numbers into zip codes, because the people at the hospital, the nurses at the hospital, wanted to know the areas in the county that they lived. So your gray was, 1, 2, 7, 9, 10 deaths. And then the ones below that, the blue was your lower numbers, the gray was your kind of medium numbers, and then the red, we had one county that we had 19 deaths in that year. And those are the areas that we're really trying to focus on. Those are the areas that we let the stats, give our stats to healthy families and Healthy Start, because they're the ones that are out in the community also going into the homes and working with the parents, and we want them to know the areas that we're looking at and where our numbers are the highest. Next one. We had 67% of our infants died because sleeping in the bed with the adults or with siblings. We had 33 that were put in other locations. Some of them were put on sofas, some of them were sleeping on air mattresses, some of them were sleeping on futons, and then we have some parents that, even though it's changed over the years, they're still putting their babies down to sleep on their stomach. And the baby, of course, they've got all the nice little things in the crib, so the baby's getting their face up against the bumper pads and stuff, and they're smothering. So that's one of the other things that we're educating on is, even though you're putting them in the crib or the bassinet, put them on their back with nothing else in the crib with them, which is it's hard for parents to accept that, because they think they get cold. They think, the crib's decorated so nicely, but it's just a hard lesson that parents have to learn. Next. And then this is just kind of showing the parents that even though you may want the pillows and the cover and all of this and the stuffed animals, that is what can kill a baby. That is what can smother a baby, suffocate a baby. So you have to have all of that out. Next one. And then it's just the tips of the ABCs alone on the back in the crib. Next. Share a room, not a bed. That has been our message. Don't co-sleep. You can share a room, but don't share the bed with anybody. So we like to make sure that they understand that. Next. And then stay alert while feeding. And this was one of the things that we really struggled with a few of our hospitals, especially your lactation specialists, because they push breastfeeding. And we really had to get them to understand, we're not saying don't breastfeed. We're saying don't sleep in the bed with your baby and feed while you're breastfeeding. Get up, sit in a rocking chair, sit on this, I don't even like to say sit on the side of the bed, even though we do, give that as an option. We want them to be up feeding this baby. And it goes the same way for dad. Even if you have a dad that's feeding from a bottle, We have a lot of dads that want to prop the baby, prop up in the bed, and then they go to sleep, slide down, the baby ends up between the parents in the bed. You need to be getting up to feed these the infants, not feeding them while you're in that bed. Next. And then there's the million ways to raise the babies, but only one way to lay them down safely. This is what we use when we're trained, not with parents. This is what we use when we're training the other professionals, our community partners, our fire rescue, our law enforcement, our hospital personnel. We want them to know that this is the message we need to give out. And it's amazing how many of the people, nurses specifically at the hospitals, did not realize how much of an issue this were. They knew it happened some, but when we really put the statistics out there for them, it was like it was a wake-up call to them, like it was to me. I'll be honest, it was a wake-up call to me to find out that Duval County had the highest numbers. And it's been a wake-up call, and they've really gotten involved in saying, we can prevent this, we can work to keep these babies safe and get them to their first birthday. So that's all I have. If y'all have any questions, I'll be glad to answer them, or if there's anything else, if there's any information that I can send to you, if you'll let me know or send me an email, I'll be glad to send that to you also.
Vicky, which email address do you prefer questions be directed to?
My DOH.
Okay, so it's Vicky with an I.
.whitfield@flhealth.gov.
Perfect. Thank you all. Thank you, Vicky. So everyone, you can, feel free to direct questions. If you have questions, briefly, we can use the chat for about the next minute or so. Otherwise, please direct all questions to vicky.whitfield@flhealth.gov. Thank you so much, Vicky, for sharing this initiative with us, and the tremendous work that you all are doing in your community. You've definitely been a leader for many years, and we celebrate you and we appreciate all of your work.
Yeah, well, and I can tell you, it's been very difficult about the last 8 months because of COVID, but we wanted to continue it going. We just refused to say we can't get together. So a few of us took this on and did it, but now we're beginning to really get back in with our volunteers and get them in.
Amazing. So our next speaker today is Rebecca Albert. So Ms. Albert is the Strategic Initiatives Manager at Juvenile Welfare Board of Pinellas County. She also serves as the chair of the Circuit 6 Child Abuse Death Review Committee and is a member of the State Child Abuse Death Review Committee in the role of member of the Child Advocacy Organization. Ms. Albert will be speaking today on ACE's assessment in pediatrics. Thank you, Ms. Albert, and I turn the floor over to you.
Can you hear me?
Yes, we hear you.
Sure can.
Thank you. Good morning, everyone. Thanks, Josh. As he mentioned, I'm Becky Albert, Strategic Initiatives Manager at the Juvenile Welfare Board in Pinellas County. Today, I'm going to talk a little bit about a children's mental health initiative, a county-wide prevention initiative consisting of screening for adverse childhood experiences in the pediatric setting. But really, it's much more than universally screening. Next slide, please. I'll be discussing why and how we got started with our initiative, why we're universally screening in the pediatric setting, what we're learning, and the impact we're having on children and their families. Yesterday, we heard from Abby Collier, Director at the National Center for Fatality Review and Prevention. Abby shared some research related to adverse childhood experiences in brain science. Earlier this morning, we heard more about the ACEs from April Lott, President and CEO at Directions for Living, who, by the way, has been involved with our initiative from the beginning. So briefly, I want to echo some of the key points that we've heard from earlier presenters and what we know from the extensive research that's available to us today. Next slide, please. So we know that childhood experiences lay the foundation for a successful future. So the experiences that we have early in life contribute to academic success, social emotional learning, our ability to form relationships, and ultimately our general well-being. The chart on the slide shows the accumulation of adverse or traumatic experiences over time from birth to age 16. And this data is from a multi-site study that consisted of children who were at risk of or exposed to maltreatment. So the study found that children by age 6 on average had experienced at least one traumatic event by age 6. So we're talking about kindergarten, first grade. Children between the ages of 6 to 12 years old on average experience another or two ACEs or traumatic events. So when you take up to age 6 and now we're at 12, that accumulation, we're up to a score of at least a 3. And children between the ages of 12 to 16 on average accumulated at least one more ACE. So by the age 16, these children had experienced frequent and sustained stress. The accumulation of these ACEs, the experiences that they've had perpetuate toxic stress, altering their brain and body, which increases their risk for negative health outcomes, such as respiratory issues, obesity, mental health challenges, attention deficits, learning disabilities, anxiety, and depression. We know that children who experience physical abuse may behave aggressively and are more likely to abuse children of their own later in life. In fact, people with an ACE score of 4 or more are 7 times more likely to suffer from the disease of addiction and 12 times more likely to attempt suicide. Next slide, please. So we know that nearly half of all chronic mental health conditions begin by age 14, yet many children and young adults go without treatment until years later. We know that 1 in 6 children between the ages of 2 and 8 have a mental, behavioral, or developmental disorder. We know that 20% of youth will experience a mental health condition in their lifetime, and 25% of youth, that's 1 in 4 youth, actually consider suicide. And these are stats pre-COVID. So we know that suicide attempts are on the rise, at least they are here locally in Pinellas. Next slide, please. So we have systems in Pinellas, specifically systems that are designed to help people, yet these systems are siloed and have high rates of staff turnover, creating disconnects and communication gaps with clients and among other providers that are working with the same children and their families. But it's also making it very burdensome for caregivers who are trying to get help for their children. When we held focus groups with parents and caregivers, we heard time and again how frustrating it was when trying to get help for their child. That it was extremely time-consuming and even re-traumatizing when being asked to retell their story, the same story multiple times to different people. So given these challenges, we know we had to do something different, and we know that we can't solve today's problems by doing what we've always done. Next slide, please. So we brought together a group of multidisciplinary community leaders, they're decision makers from these multiple disciplines, healthcare, behavioral health. We had the schools, law enforcement, we had foundations at the table, neighborhood family centers, and other social service providers. We brought everyone together, we held a consensus workshop and established a shared vision. Next slide, please. These community leaders that came to the table had agreed that they would act as the steering committee. So everything is brought to them because we need buy-in from our community. And they also assigned staff from their organization to actively participate in one of these 5 design teams. Each design team has a specific focus. It's tasked to work collaboratively and has developed a comprehensive plan that, when fully implemented, we truly believe will result in a high-quality, service integrated, coordinated system to better support children and their families. So you see the design team in the middle that's bolded. That's the care coordination team that was responsible for identifying and bringing forth the Adverse Childhood Experiences Questionnaire, also known as the ACEQ, which I'll refer to moving forward. Later, this ACEQ obviously was approved by the steering committee for becoming a universal screening tool within the pediatric practice. Next slide, please. We partnered with the federally qualified health centers in Pinellas, who agreed to integrate behavioral health therapists and support staffs into its 5 pediatric practice locations. And hopefully you can see the stars located on the map of Pinellas County. Those stars represent the 5 pediatric practice locations. The community health centers had their pediatricians trained by experts in the field of child and adolescent psychiatry, trained to become more comfortable and knowledgeable about identifying, diagnosing, and treating low to moderate mental health conditions such as anxiety and depression. This has helped families. Having the pediatricians trained has helped families who had been experiencing long wait times when trying to get an appointment with a child psychiatrist, because our pediatricians are now able to manage the low to moderate mental health conditions more effectively rather than referring out for everything. In addition to integrating the behavioral health therapists and getting the pediatricians trained, the ACEQ is being utilized at these locations. And I believe a copy of this tool was provided for those of you who have received the packet. You'll notice that the ACEQ expands beyond the original 10 questions from the Kaiser Permanente study. So that second section of the screening tool is really focused on community level adversity, such as neighborhood violence, separation from biological parents, race, and so forth. And these items were found to contribute to adversity and stressors in children later after the Kaiser Permanente study from the Philadelphia task force. Our initial implementation of this screening is focused on children ages 4 to 11, and really in the beginning we had some pushback from our partners, not all, but questioning why we would be focusing on children in this age group, that it's the older kids who need help now. However, the reason why we chose to focus on children between the ages of 4 to 11 is because typically we know that this group experiences 2 life transitions, entering into kindergarten around the age of 5, and then around the age of 10 and 11, they go into middle school. And what we know about transitions is that they exacerbate anxiety. And if you recall from the multi-site study that I mentioned earlier, children who are at risk of abuse and/or neglect, on average, had an ACE score of 3 or more by age 12. So we're really trying to get ahead of the challenges that many children experience. We're during adolescence, but we're trying to make an intentional effort and get in front of families earlier. And the ACEQ has really been a mechanism that is helping us to accomplish that. The ACEQ is providing an opportunity for us to start a conversation with children and their caregiver, but it's also helping to reduce the stigma that is oftentimes associated with mental health. So we have this opportunity to frame mental health as a state of functioning. We want mental health to be viewed similarly to the way physical health is. Some days we feel pretty good, other days maybe we don't feel well at all. And when you're not feeling well for an extended period of time, you go to the doctor, right? So we want individuals to respond similarly when experiencing mental health challenges, and know that it's okay to not be okay. And we want children and their families to ask for help when needed. Next slide, please. So the ACEQ is about creating caring environments within and outside of the pediatric setting. It's helping to increase the caregiver's awareness, understanding what healthy coping looks like, and ways to model healthy behaviors. Behaviors that can teach children how to manage stress and how to become resilient. You know, it seems like resiliency is the latest buzzword, and yet so often it's misunderstood. I'm sure most of you have heard someone say, kids are resilient, they'll get over it. But the fact is that kids are not resilient unless they learn how to be. Support staff that are integrated within these pediatric practices are using evidence-based buffing wheels with families to help guide some of the conversation about healthy ways to reduce stressors and cope with times that are tough, and whether you're going through a time now or later on. But what we know to be true is that tough times will happen because they happen to all of us. The staff may even work with the caregiver to establish a goal or two and then circle back during the next visit to learn how well their goals are working. Next slide, please. So using the ACEQ is really creating opportunities for raising awareness and education about mental health in the pediatric practice. It's about putting the family first. And we know that if the caregiver isn't supported or doing well, then it's going to be very challenging for us to help the child. This initiative has led to new relationships that are mutually beneficial, relationships between systems such as the schools, pediatricians, behavioral health therapists, hospitals, other providers who are equipped to address social determinants of health, like food insecurities, housing, and so forth. Prior to this initiative, pediatricians weren't familiar with services that are available in our community. They just weren't. They're becoming more familiar. The staff now within the pediatric practice are very familiar. But the schools have been a critical piece to this initiative as well. So having a partnership with the schools is key. Our pediatricians learn that they just can't write a script for an IEP or 504 plan. There's actually an extensive process to have a child be evaluated and determine whether or not they meet the criteria for one of those plans. But what the pediatricians can do is assist the school by communicating and coordinating and providing information so that interventions can be placed in the school setting sooner. Next slide, please. So we're learning quite a bit from this initiative. We know we have a long way to go, but highlights from the first year, and this is really, I said, you know, we've been doing this for about 3 years, but we're really in our right now second year of having staff integrated into the primary care setting. So I'm going to give you a little bit of the outcomes that we've seen in the first year once we had staff hired, trained, and working with families. Overall, we've increased access to mental health services for children and their families. We have a better coordinated approach to care with our community partners. We're beginning to understand the service population better. We've screened over 10,000 children using the ACEQ. Nearly 1,000 of these children who have been screened met with a behavioral health therapist and support staff. And on average, these children had at least 2 behavioral health visits. Of these, 65% received 3 referrals or more, referrals and linkages to external services and support, such as needing food or respite care, kinship care for caregiver, for grandparents caring for their grandchildren, in-home therapy, and so forth. We have 9 team members integrated into these pediatric practices, and we have hired 3 of the 5 behavioral health therapist positions, which are still in place today. We've developed a modified workflows, including one for accessing same-day behavioral health services, because that was not happening initially. And we've created multiple technology enhancements to include a closed loop process for exchanging patient information, of course, with the proper consents in place. And that's what I have. So I'll take questions if there are any.
Thank you so much, Becky. we'll go ahead and open it up to questions at this time.
Got one from Ray.
Oh, we do have one from Ray Hensley. Ray asks, are there plans to expand this mental health initiative?
Yes, there are. We have plans to expand this mental health initiative, and we're super excited because the largest pediatric practice in North County, we're working with to secure an agreement and really integrate some of the staff similar to what we have at the community health centers within the practice in North County. And what's great is that the community health centers, what a great partnership, great leaders they have there. They are really, they've agreed to, you know, walk alongside this other practice to guide them through the process because it wasn't easy when we first started, but we're super excited because we know that we're getting services to children and families earlier.
Certainly. We do have another question from Dr. Perry. Rebecca, has there been any follow-up data on service utilization of those referred for services?
Has there been any follow-up data on service utilization? Can you expand on that question? What type of data? How frequently?
I'll await his response. In the meantime, we do have a comment from Danielle Hintz. Excellent overview, Becky. That the chart that shows the system as well as the numbers of ACEQ is really inspiring and helpful. And Connie asks, what was the cost of the program and how long did it take to implement?
So we're still working on you know, implementation, training the staff within the pediatric practices is an ongoing process. The organization that I'm from, JWB, has invested a little over $1 million to partnership with the community health centers in Pinellas. But there are a lot of in-kind costs. So our partners are really stepping in, and I should say leaning in and stepping up and realizing that we have to work together instead of, I would say, maybe even competing against one another at times if we're really going to help children in our community. And we need everyone to do that. So I don't have a specific dollar amount, Connie, but I know that JWB has invested a little over $1 million, and that's annually.
So I think Dr. Perry did expound on his question a little bit. I said, oh, can you, okay, sorry. Are you able to see it, Becky?
You noted that, and among the 1,000 referred for initial behavioral health visits, there was on average 2 visits, and that there were other referrals for service to other providers. Is there any follow-up on those? Oh, yes, absolutely. So the one slide, so every Wednesday, a smaller group of our multidisciplinary team comes together, the pediatricians and the support staff do case presentations, and some of the case presentations are follow-up from the families who have been referred to external services. So, and that's really what I'm talking about too with the close the loop with technology, because while we're really looking at each child, one child at a time, eventually these workflows that are becoming more automated over time and triaging based on risk stratification, it will become more automated. But yes, the follow-up with our external referrals and linkages are there. And what we're finding is for some families, working with our partners, it takes a significant amount of time to get a service. And one service in particular is like a psychiatric evaluation. So we're identifying gaps, we're discovering new things, which is helping us to inform stakeholders and hopefully the state eventually.
Yeah, Rebecca, I think this is exceptional, and it's a really good practice that you're doing. And again, you've mentioned, I was going to have a follow-up question, which you sort of addressed, that you've utilized you've done at least some anecdotal, but perhaps more formalized analysis to identify gaps. So if you're looking at service utilization trends, you're also identifying where, if they're utilizing the services, but then it sounds like you're also identifying if there was a delay in getting those services and what the precipitating factors are impacting upon that. How do you guys do problem solving when you've identified a gap or an unmet need?
So the problems really then go back into our design teams, the 5 groups that have a specific focus. And then we also work through these problems with our steering committee. So I'll give you one example. We're lacking clinicians in our community that have, I'll use the word certification, who are really specialized in trauma-informed, trauma-focused CBT. So that's something that we're looking to increase capacity by offering scholarships for training clinicians. But ultimately, we know that there is a shortage of therapists, of licensed therapists. There's a shortage of some of the types of professionals that we need, not just locally, but nationally. So.
Thank you, Becky. There is one more question in the chat from Connie. Do you have the ACEs broken down by zip code? It would be helpful to law enforcement when you initiate handle with care in the law enforcement community.
So I don't have that information with me today, but yes, so the ACE scores are directly connected to the individual and can be broken down by zip code and even census tract. So we're capturing that data.
Yeah, and this is Connie, and I think this is really going to be important as you move your community forward, and law enforcement is a big part of that, understanding adverse childhood experiences and how they may impact that with arrest to parents and so forth. So I'm really hoping that when you start to introduce that topic and you initiate the handle with care in your county and you bring law enforcement on, I think that showing the zip codes, the officers will relate to that because it might be the area that they're working, and it can really help to promote the whole handle with care initiative for them and to be more sensitive to how they play a role in the ACEs of these children. But thank you for all the hard work you're doing. It's wonderful.
Thank you, Connie. Great point. I will take that back to our team.
Thank you so much, Becky. And we will field any additional questions and send them your way. Is there an email address that you would like participants to be able to access?
I can type it in the chat.
Perfect. Thank you. So our next speaker today is Taylor Freeman. Taylor is the Public Health Planning Manager for the Florida Department of Health in Polk County, and she's also the Health Department representative on the Circuit 10 Child Abuse Death Review Committee. Taylor, today we'll be talking about their drowning prevention initiative in Polk County. Thank you, Taylor.
Hey, Josh, thank you. Can everybody hear me? Because I have my headphones in. Are we
Thank
good?
you.
Okay, perfect. My coworker behind me has a different meeting, so I was trying to be respectful. Good morning, everybody. As Josh said, I am Taylor Freeman. I am the Public Health Planning Manager for the Florida Department of Health in Polk County. And I also work very, very closely with the chair of our Circuit 10 Child Abuse Death Review team, David Osvedo. So I have a big part on that team. So I'm just here today to kind of discuss with you some of the water safety efforts that we have put into place in Circuit 10. And I do want to have a little bit of a disclaimer, really two. Number one, it's very intimidating to go after Becky, who had such an amazing presentation, because I'm really just going to sit here and chat with all of you today. And then the second one is you're going to hear me talk a lot about Polk County. And yes, we are Circuit 10, which includes Highlands, Hardy, and Polk, but most of our drowning accidents actually occur and are centralized in Polk County. And our red alarm bells kind of started going off for our Polk County drowning rates this year. So you'll hear me talk a lot about Polk efforts specifically, and how those bled over into our other counties in our circuit. So at about halfway through last year, we received an email from the Child Abuse Death Review team at Central Office informing us of a data dive that they did for all of the drowning fatalities in the state of Florida. And they ranked all of the counties in order of highest incidence of drowning. And Polk County was number 2, which was completely shocking and upsetting to me, as I work very closely with all of the water safety efforts, and it's a personal passion of mine. So of course, we went directly to our Child Abuse Death Review team, and then from that, we went to our Coalition on Injury Prevention, who coordinates all of our water safety efforts here in Polk. And we said, hey, we need to figure out what is going on and where these drownings are happening. Like the theme of our summit, it's all about data and how we transform that into action. So we have to start with the data. So that is what we did. We contacted Polk Fire Rescue, and here in Polk, I'm not sure if every county is like this, but we have coordinated dispatch. So Polk County Fire Rescue actually gets every single dispatch call that is called into 911, and they keep obviously logs of that. So we were able to pull all of the drowning accidents and break those down and kind of look at the trends, where those happen, what cities are being affected by that most, and what age groups, and any race or ethnicity trend lines that we're seeing, anything like that, so that we can specifically tailor our messaging to those populations that need those things the most. And so what we were finding was that some things were not really unexpected. When we looked at our 2020 data specifically, that we saw that there was a little bit of a shift in our drowning accidents, that we still had Davenport as one of our top cities, and then Lakeland, which is our first largest city here in Polk County. I had to think about that. So that wasn't really that unexpected. And then Haines City as well, which is our 3rd largest city here. So the large cities weren't really unexpected, but we did have a pretty good spike in the Davenport area, which caused us to dive into that further to look at what was going on in the Davenport area. And something interesting that we found was that the drownings that happened at vacation rentals skyrocketed. They actually tripled. So in 2019, out of all of the drownings that did occur in that same area, only 3 of them were in a vacation rental home. In 2020, there were 10 drownings that happened in the area, and 9 of them happened in vacation rental homes. So that was something we definitely wanted to put on our radar and kind of keep in mind when we were putting together all of our interventions. So once we had all of that information, did we get near drowning calls also? If so, how did that increase the overall data? So actually, yes, we did get near drowning calls as well. And when we were looking at calls data, we were looking at all drowning calls. We actually were not focusing on just the fatalities. So when I'm telling you there were 10 drownings, that was actually submersions. So I appreciate you, Connie, for making sure that I clarify that. We were talking about submersion. So these are incidents. These are not necessarily total fatalities when I'm talking calls data here. So we did take a look at that, and we did want to keep that in mind, because our group of professionals here said that if we were only looking at fatalities, then we're not really getting to the root of the prevention. We have to look at how many incidents are specifically happening and where, so that we can target those areas. And I will say that if we do look at, just to answer the second question, Connie, if we do look at our drowning incidents and then we compare that to our calls data, I would say we have about a double increase. So we had a count of about 14 fatalities last year in drowning, and then we had 27 individual calls. So it's about, half. And that is actually something that has been a trend since about 2015. It's usually always about half of the calls end in a fatality. And so once we looked at all this data and we were able to pinpoint some locations and some populations, and then the whole rental property thing, we were able to start looking at how did we want to try to address those issues. And I don't know how much everybody else knows about Polk County, but one of our only claims to fame is that we're huge land area wise. We are the size of either Rhode Island or Delaware, whichever one you would like to choose. Fun fact, they're both actually the same size. And so that kind of presents a problem when we have a population, but we have such a large area to spread our initiatives across. We typically find that, our initiatives and our interventions get centered into just the major cities, and sometimes it's kind of hard to do some of that more rural outreach. But, and I don't say this often because I'm a health department employee, but something good that came out of the pandemic for us was the fact that during most of 2020, all of our meetings were virtual, which actually increased participation in our meetings. And at the same time, our health department was actually going through their community health assessment process. And so they were going around the county. I say they, it was myself and my counterpart. We were going around the county and we were already giving presentations on the data that was happening in the county. And so the Child Abuse Death Review came to us and they said, hey, can we add some drowning data in this presentation when you're going throughout the county so that we can alert all of our community partners that this is an issue and that this is something that we need to start educating on and make sure that everybody is building into the conversations that they're having with the families that they serve. So we said, absolutely. Like I said, water safety is my passion. So I was all about it. And we added it. And then when we were giving presentations, we would make sure that we discussed this at the end of all of our health assessment data presentations. And that was one of the most beautiful things about this, because it just created a very organic partnership between all of the community partners across this huge land mass. And it allowed us to all get resources to each other and kind of have those conversations that might have been missed earlier, and connections of who has contacts where and where we can get into more areas to reach bigger populations. And so one of the things that was actually able to come out of that was all 3 of our hospital systems here in Polk County, they contacted us and they were asking if they could have some water safety resources so that they can work those into some of their satellite offices where they have pediatric visits. And then also in the children's ER, work that into the conversations that they're having with parents, and then leave them with a water watcher tag and then an infographic explaining, water safety and all of our tips as far as like why you should have active supervision and the importance of door alarms and fencing and pool barriers, and the importance of being certified in CPR, and the importance of having children in swim lessons with certified swim instructors. And so through that, it kind of snowballed into other pediatric offices reaching out and saying, hey, we want to work this into our child wellness visits. Can you give us some similar resources? So we started bringing those resources to different pediatricians' offices that are in the area. And then from there, we were able to give those same resources to our WIC staff. And so they were able to work that conversation into every single visit that they have with any of the clients receiving WIC services. And then the same thing kind of happened with other agencies, Healthy Families, Healthy Start. Then we got to the Department of Children and Families, and they were very, very excited and very passionate. And of course, they have to deal with these incidents all the time and investigating drownings and just interviewing families and things like that. And so they reached out to us and they said that what they wanted to do was obviously give the resources that we're giving, but they also wanted to work in water safety education as part of their orientation and onboarding for all of their new staff, and then also as part of like the annual training that they give to all of case managers and CPIs that are going into the homes and working with our families. So we were actually able to create a water safety curriculum that we are now offering on an annual basis. We're about to go through our second round of those trainings so that anytime, and we actually offer it twice a year, so it's a biannual basis, I guess. So anytime that there is new staff onboarded, then they're able to attend one of those 2 trainings, and we make sure that not only do we educate on the data and the interventions and the protective barriers that should happen to protect children from a drowning incident, we also actually go ahead and we print all of the resources that they would need to hand out to families, and we give them an initial like stock of printed materials, including swimming safety tips from Safe Kids, including our water watcher tags that we received from the state, including our infographics. And then they are able to print them from PDF form after that, but we do supply them with an initial big chunk there. And then we also received some feedback that something that would be really useful for the community is knowing where they can get swim lessons. And that was something that was useful, obviously, before. It was, since we are so big, it is important to make sure that we know all of the locations that are offering these services. But with the pandemic, that actually, the need for that document increased twofold. And if you look in your packet, that's actually the document that I provided for all of you guys just to view, is that we decided we were going to take all of those swim lessons and we were going to create one big master list of everywhere that offers swim lessons, what the cost of those lessons are, if they offer scholarships, who to contact, what days of the week that they offer those, what times, if you have to have a membership, like for example, if it's at a YMCA, or even some of our city pools. And then if they offer private lessons for those who have special needs. And so we included all of that information on one just big chart document swim lessons list, and we have actually hosted that on our Department of Health website. And we actually have just recently created little postcards that have a QR scanning code. And so we have handed them out at only one health fair so far, but we're planning on handing them out at future health fairs and of course the rest of the summer. But if you scan that QR code with your phone, it actually will take you to the webpage, the DOH webpage that has the Polk County swim lessons list directly on that. And then we also, of course, always put a little asterisk at the bottom talking about if they wanted further private lessons, where they can find information about that, and about CPR certification classes if any families are interested in that. What are the average ages of children drowning in your area? So actually our biggest age group is for drownings with us is our 5 to 9-year-olds. If you look at all of children, obviously 0 to 9 is our largest group, but when we look specifically at those 5 to 9-year-olds, the ones that are, just getting into school, they're a little bit more autonomous, they're trying to do things on their own and possibly have a false sense of security of thinking that they already know how to swim, considering they have had floaties or what have you, or possibly even swim lessons when they were younger. So we do see like a little bit older of an age group, which was something that our group decided to put into our action plan this year to shift, because we were focusing on those younger kids previously. I'm trying to think if there's anything else that I did not mention that we have been doing. Oh, the other thing that we were able to do that was that I thought was really cool was we have kind of a hard time, especially with the topic of water safety, reaching our Spanish-speaking population and specifically the migrant workers that live and reside in Polk County for a good chunk of the year. And so we were actually able to make contact with Redlands Christian Migrant Association and a lot of the other community partners that work directly with that population. And we were able to provide them with some Spanish resources. We were able to provide them with Spanish water watcher tags. And then Safe Kids actually has like a pool safety checklist and then a pool barriers checklist written in Spanish. So we were able to provide that to them as well. And we got really good feedback, and they actually have asked if we would continue providing resources for that specific population. So that was something I was really excited about, as a little win for us. Yeah, but basically it is for us specifically, it is just looking at the different needs of each different area, and then leveraging the passion that exists already for the children in our county in every single community partner. I mean, Polk County is definitely not short on passion at all. And oh, the only other thing that I did want to say, something that we are looking forward to doing. As I said at the very beginning, we saw that Davenport, specifically, the rate of drowning in rental properties tripled. And so we actually have started trying to look into that, and we are partnering with DCF and some other community partners to try to figure out who, because it's Airbnbs specifically, so like who at Airbnb we could contact to try to see if we could just implement or provide them even with some water safety education that they could just leave in the welcome book or what have you, to try to get some more of those rental properties on board and kind of reach that hotspot area. So that being said, if anybody knows who runs corporate Airbnb, please email me and let me know. Let's see. Connie says, have you reduced the drowning and near drowning episodes since you put these initiatives into place? So I would actually like to respectfully ask you to follow up with me next year on a lot of the data specifically for that question, because we reviewed in February, what we did was we reviewed the 2020 data. So we have a little bit of fresh data, but I will also be honest, the individual that was in charge of delivering water safety resources to the entire county was myself. And so I am a high risk person for COVID. So I actually was teleworking until May 27th, until I was fully vaccinated, and I was unable to deliver any resources. So these initiatives actually have only started having true action on them for about a month and a half, maybe 2 whole months. So we are trying to definitely keep our thumb on that and kind of look monthly. But towards the end of the year, I will have a way better, more firm answer for you, Connie. And if you ask me again next year, I'll be able to like give you a chart with averages and make it all pretty, I promise. Trading that, yes, okay, yeah. That's what I was thinking too. For anybody that couldn't read that, Connie suggested that we look at our Chamber of Commerce and see if they have any contacts with the Airbnbs. And so, yes, we actually have reached out to a couple chambers of commerce, and we are waiting to see if they will plug into our next water safety initiative meeting, which is next month. So hopefully we will get some traction on that, and they will be able to give us some Airbnb contacts. Were there any other questions, or maybe something that you thought I looked over or forgot?
Thank you so much, Taylor. Thank you for presenting and for sharing the amazing work that you all are doing. We definitely look forward to hearing how this project progresses over the coming year. It's important to know, especially and to keep in mind for Central and South Florida, especially, that swimming doesn't stop after the summer months, so to sustain these initiatives and keep them going throughout the course of the year is of utmost importance, especially with numbers on the rise this year. I had some correspondence with Kirby Morgan yesterday.
Yes.
And, and he really wanted to alert us to, to the issue that we're facing this year, this year especially. I believe numbers have been on the rise for the past couple of years, but this year it's higher in Central Florida than it has been in any year before. So, thank you all for all the work that you're doing, and everyone on the call today, just please remain vigilant in your efforts to provide drowning prevention education.
Yes, and if you guys need any resources, or if you'd like to see the training that we organized and created for the DCF case managers, anything like that, feel free to email me at any time. I am open to all conversation. And like I said, water safety has been a very big passion of mine since I was the Little Mermaid at Disney at 15 years old. So I am definitely dialed into this topic.
So you worked at Disney. That explains your bubbly personality.
Yes, just don't ask me to
Appreciate
sing
all the
because I
energy
can't.
that you brought to your presentation today. Thank you very much. So our next presenter is Casey McGovern, and Casey is the former chair of the Circuit 17 Child Abuse Death Review Committee and the current founder of the McGovern Foundation, which is aimed at raising awareness regarding drowning prevention and organ donation. Casey has been an amazing advocate and has actually started a grassroots effort in the Broward County area around drowning prevention. So, it's definitely a pleasure to have Casey here presenting, and always is. Casey, I turn the floor over to you.
Oops, still
You're
muted.
muted.
There we go.
Can you hear me now?
Yes, we hear you.
Right now, we're looking at your email. Oh, your mic went out. There we go.
My mic, can you hear me now?
Yes,
Yes,
ma'am.
we hear you.
You can hear me now, yes, right? Okay, good afternoon, everybody. I am going to share my screen. Thank you for the introduction. It has been an amazing 2 days of listening to all of the different amazing speakers. I am absolutely blessed and honored to be part of it. And again, just like Taylor mentioned, I think that it's definitely hard to follow suit with everybody that has been so dynamic with their presentations, but hopefully I'll be able to give you some nuggets that you can implement into your areas. But let me just get started. My name is Casey McGovern, and I actually held the position of the Drowning Prevention Program Manager with the Florida Department of Health in Broward County for the past 7 years. Just recently decided to go out and follow my own dreams and continue drowning prevention, but hopefully filling in the gaps that I saw that were around throughout my time at the health department. And so what I'm going to share with you guys today is a little bit about why I'm committed to drowning prevention and what we actually found by looking at the data and some of the cool initiatives and amazing initiatives that we created during my time with the health department. But if you don't mind, I'm going to just play a short video as far as exactly why I'm so committed to drowning prevention, and then we'll keep moving forward.
Casey, just a heads up, the GoToWebinar doesn't usually play nice with videos, so we may run into problems. We'll see what we get.
Okay. So what I could do is I could share it instead. I'll just go to the next slide if that makes sense. I will just move forward with my slide. The videos you said the web does not work out well.
It's meant to be a screen sharing. The sound doesn't always carry over, but we can give it a try. You want?
No, it's okay. I will, if I could figure out how to proceed with the next slide, I am all good. Oh, can you hear it now?
In May came along as a little bit of an unexpected surprise.
You can hear it a little bit, I think, through your mic.
Just had moved into our house, and it was amazing. Just had the 2 little girls running around.
Oh, sorry. Could you hear it? I'm sorry.
Yes.
Okay, that's what I was just going to ask you.
And be bopping around. We had our 3 girls, and life was just awesome. However, we spent the day in the pool. We had just got back from vacation from Vermont, spending time with family, and we decided to spend the day in the pool, where we all were there. Allie had a friend over. Shannon and Taylor and Em and I were out there having popsicles and just enjoying the pool. I came in to give Edna Mae a nap and told Shannon I was going to go grocery shopping. So I laid Edna Mae down. She was sleeping, and I came back, and she met me at the door through the garage in the laundry room. She met me there, and I put her in the rocking chair in that room adjacent to the kitchen, with a sippy cup in front of the TV while I proceeded to put groceries away. Shannon was in the front living room conducting an interview for work, and I was just putting groceries away. He had called me into the front living room at the time, and which is adjacent to the pool. And when I looked out, when he asked me the question, I looked out, I thought, why is my slider door open? You know, I just thought air conditioning's going outside in the dead of summer. I'm like, what's going on? Why is that there? Didn't think anything of it whatsoever. I proceeded to go into the bedrooms. I didn't see Em in the family room, so I went into the bedrooms where the girls were, and I said, Allie, you know, is Taylor and Em in here with you? And she said Taylor was, but Em was not. So again, I did not panic because our gates are always shut on our pool. And I actually picked up a piece of clothing Edna Mae floating in our pool.
Very fortunate to, can you hear me?
We can hear you now. You dropped out for just a second.
Okay, I'm sorry about that. Okay, but that was pretty much the reason why. Obviously, I committed my life to drowning prevention. I was an office manager before that with a business degree, and I just knew that I had to do something. I knew that my voice had to be heard. I knew that I was one of many. The stigma that's attached to drowning victims and the families that are associated with them is pretty harsh. You know, you read the articles that happen after drowning, and every single person's comment is, where are the parents? The parents should be charged. And so I just felt like I wanted to be the voice for all of those families and letting them know that good parents have this happen too, and just sharing those pieces that knowledge is power. I mean, the more we know, the more we share this information without judging or criticizing, the better we're going to be. I also felt like part of the position that I held was sitting on the committee of our local Circuit 17 death review. And I actually had the opportunity to educate all of the CPIs, the Child Protective Investigators, and share my point of view from a parent, and having that bedside manner and having having them understand how a parent sees what they're doing. And so it was a really gratifying experience, and being able to just share my point of view with them. But moving forward, I just kind of want to go into the details, and I think you guys already know the details, that we lose approximately 10 people per day to a preventable drowning incident. These are not boating related incidences. These are all drownings or water related incidences that could have been prevented. Drowning is the third leading cause of unintentional injury worldwide. In the United States and also Florida, bringing it closer home, it is the #1 cause of unintentional death for children ages 1 to 4, right behind unsafe sleep or safe sleep with ages 1 and under. State of Florida continues to lead the amount of drownings that we definitely have. Oops, I'm sorry, I'm moving the screen around trying to see the numbers and everything. Over the course of the last 3 years, I included the data here, just showing you the numbers that we have lost to children, according to my Florida Families, or DCF. We are currently at 61 drowning fatalities since I created this PowerPoint the end of last week, which means we're just going up so quickly, and we have a large problem. We're not even halfway through the end of the year, and we're at the numbers that we usually end the year with. And so I feel like collaboration is a huge factor. I think education is power. Broward County current fatalities And that's usually, again, how we usually end.
Casey, I think we're losing your audio again.
You are?
You're back. Sorry about that.
I'm sorry about
Ready?
I'm not sure exactly what's happening. On my end, I don't see any kind of pop-ups that say my internet is spotty, but I do apologize. Can you hear
No
me
worries.
okay?
Yep, seem to be fine now. Thanks.
Okay. But I feel like looking at the data is something that's so relevant and something that we completely have to do in order for us to see the real problem and what we're dealing with. And so it's always swim season. We always have to make sure that we never let our guard down, that we're constantly having these conversations, that we know that we live in an area that's surrounded with water no matter what we look at. Just like Taylor mentioned, they had an uptick in Airbnbs. I mean, a lot of people don't think about that. And in previous years, we did have a couple drownings that happened at Airbnbs, but primarily what we see is water watcher issues and different things like that. But to go back to where we started, back in 2016, I realized that what the stigma was is the child getting out of the home undetected. And I felt like that wasn't the real reason. Like as I started to look at it, I realized that there must be more to it. And so what we did was we created an MOU and an MOA with Broward Sheriff's Office, CPIS. And with that MOA, we were able to review all water-related incidences. And that's fatals as well as non-fatals. So any child that was called, any incident that was called into the abuse hotline, we were able to really look in the details and staff each case with the investigator. We were able to find out the location. We were able to find out the zip code. We were able to find out the water source, what the caregiver was, the highest level of education for the caregiver, if the parents or siblings knew how to swim, and all of these amazing little bullet points or data points for us to create new initiatives based on what we were seeing. And one of the first things that we identified is that majority of our drownings that were happening at that time were water-related gatherings, water watcher issues. So there was parties, there was gatherings where people thought that they were watching the children, but they technically were not watching the children. And so we really tried to identify those specific pieces. When we looked at the zip codes, because we have 31 municipalities within Broward County alone. So our county is quite large and a lot to handle when you're trying to work with each individual city. So we did a huge campaign, and thankfully the Children's Services Council, who funded our program at the health department to begin with, saw the need. And so what we did was we looked over like the 2017 data. Again, we ended that year with 8 drowning fatalities, but 5 of the drowning fatalities happened during pool parties, gatherings, different things like that at relatives' homes, where you kind of let the guard down and you kind of like enjoying the company, and things like this happen with the child slipping away, or even you guys are on the patio and the child goes into the water, because I don't think many parents realize that it's quick and it's silent. I think they're going to see like the movies of the flailing of the arms and the screaming. And in most cases, a drowning happens without a splash or even a sound. And so what we did was we really worked hard to identify those issues, and we created a couple different campaigns. We had a video or a PSA that was created, and it was short and in context, but what it did is hit home. You know, it was pretty powerful piece where if you're not watching, bad things happen. So that's kind of the campaign. And we had bus wraps that went around the entire county throughout the course of May to August. We also did the campaign of billboards throughout. And this was the PSA that we created. And I hope that we'll be able to hear it because it is pretty great. So that was a pretty, impactful video, and we actually got a lot of pushback from the transportation piece, where they didn't want to put something so shocking on the side of the buses. They didn't want to put it out there into the public because it felt like it was too, I don't know, tough for people to hear. But that is the reality of what happens if a drowning occurs. And so we really needed to stick to our guns, and it was allowed, and it was actually well received. And I think it's really a well done piece, and you guys can all have that after the fact. I'm sure that the group can share it. Another piece was, when we talked about it, was the collaboration, and really bringing different partners that are related to drowning prevention. And many people don't think about the many partners that really come in contact with families, as well as children. So any person or any professional that comes in contact with the child throughout the course of their workday is somebody that I wanted to attend the symposium. So it could be a pool professional that owns a retail store. It could be a service pool technician. It could be a realtor. It could be a home inspector. There's just so many different points that we really wanted to have happen. And so that was the point where I'm like, I want everybody that comes in contact with a child throughout the course of workday to be in one room where we talk about water safety, we talk about solutions, we talk about what they're doing, and share, so we can all learn from each other, similar to what we're doing here today at the summit and yesterday as well. And so we've actually just had our 5th South Florida Water Safety Symposium. We have Miami-Dade, Broward, and Palm Beach County participating as host. And we've been able to educate at least 300 individuals each and every year in this context. And up until this year, we were in person, and we had that number of people come and devote the entire day to learn about drowning prevention, hear about different speakers, had wonderful sponsors that would provide a lunch or breakfast for the attendees. So there was a lot of buy-in, and it was a lot of collaboration and just a lot of networking where we're learning with each other. And I do believe that this is one of the big pieces that was really successful that we implemented during my time at the health department, because we all do have to work together. We all do have really great things going on in our communities. But if we don't learn from each other and collaborate, then it's just we're all doing individual pieces, and we're stronger together. And so that was my thought behind the Water Safety Symposium. And thankfully, we had Joshua and his team present on what Cater does and what the Death Review really does for us too, because they're a really influential partner for us too. We all work together for the greater good to address, having our children be safer in our community. A couple other areas that we worked on is a teen program. And the reason why we really wanted to focus on the teens is, if a child doesn't know how to swim, it's in most cases, if a parent doesn't know how to swim, a teen or a child will not learn how to swim. A lot of parents were taught to the sink or swim method. And again, what that did is evoked fear and like this anxiety with the water. And what we want to do is change a generation. We want them to understand that they can learn and how to be safe around the water. And so what we did was we implemented a SPUD program, Students Preventing Unintentional Drownings. And what we felt like is, if we get to the middle school or high school students and educate them at the risk factors and teach them how to be water safety ambassadors, then hopefully one day when they're babysitting, or even parents of their own, they'll see the value of being safe in and around the water, as well as just becoming swimmers, and also maybe even having a job in the aquatics realm, because there's a lot of amazing jobs in that realm that they might not even think about, because they're raised in a way to fear the water instead of really just enjoying it. And we live in a state where we all have to know at least the basics. I don't encourage any one of the students to become like a Michael Phelps swimmer, Olympic swimmer. And most of our SPUD students actually do not know how to swim. We went into different demographics throughout the community, and what we did was we talked to different teachers that would actually want to have a buy-in, because we did not pay them to be part of this club. We asked them for their time. We asked them for 2 days of the month that we can come in and educate their students and work with their students. We took over the class. We created the curriculum, and we brought a lot of great things to the students. We taught them leadership skills. We taught them character development. We did a lot of icebreaker games so that these students that might not have known each other came into this club and became really close and really good friends. We did a lot of outreach events. We had our students that we gave them service hours to help us at the outreach events. We did outreach events at their schools so that they educate their peers. Then we actually had them create stations where we connected with the Head Start program. The Head Start program came and picked up our teens, bused them to the local Head Start schools, and the students worked and created their stations and educating the preschoolers with their stations, whether it's reading, fishing, talking about flotation devices, and so on. We also taught all of the students CPR, not all certified, but at least they did the friends and family so that they know what to do if an emergency happens. And so this is just looking to change a generation, because what we found is, yes, primarily ages 1 to 4 were the biggest at-risk age, but we were having actually 60 to 80 individuals drown in our county every single year. And so yes, 1 to 4 is the most at risk. However, when we get to the age of 20 and above, we were having a lot more adults drown in our community than we were children. So we knew that we had to do something related to that age group before they become adults and parents themselves. And so this has been something that was really gratifying. And again, we were in 10 to 11 schools each and every year, impacting over 400 students every year as well. So this is just something else that we really implemented, and I think it's going pretty well, and I'm going to miss that piece of my job, that's for sure. The resources, I really just redirect everybody to the WaterSmart Florida website, because I believe that that's the clearinghouse for water, everything water safety. Again, you can't, reaching out to me, I can only kind of give you the resources related to Broward County specifically. But if you go to WaterSmart Broward, they have connections with all the local task force, all the resources. And if they need help in Duval, if they need help in Hillsborough, if they need help in Broward, Amanda and her team will direct them to us. And so I really recommend everybody to just keep pushing WaterSmart Florida as a clearinghouse, so that if you get the resources, you'll be able to get the right help to the right families if anybody has questions. But that's about it. I tried to keep under my 20 minutes. I know I get long-winded. Hopefully those initiatives kind of hit home. If you have any questions, by all means, here's my contact information. I'd be more than happy to share any information with you. But I thank you for your time. Yeah, that's a great point, Melissa. I just saw, and parents who cannot swim may not try to rescue a child. We've actually discussed that a lot, where if a parent does not know how to swim, we really don't want them to go and rescue the child anyway. We want them to do a reach, throw, don't go. So that's part of our presentations, our education, because education is power. So they become 2 victims instead of 1. And so what we want to do is make sure that they know how to rescue their child in a safe way if that were to happen. Going to the beach, making sure that you always swim near a lifeguard, and don't act like a hero. Even if it's your child that gets in distress, you should be within arm's reach. But just in case an incident happens, make sure that you're swimming with a lifeguard, and you alert a lifeguard instead of you going out and being that hero. Because again, what we'll end up having is 2 victims instead of 1. So I'm going to look to see if there's any questions. Should I stop sharing my screen?
You're welcome to, yeah.
I'm trying to find how I do that.
No worries.
Okay.
Sure.
Is that good? Is that good? All right.
Good.
Do you guys see any questions that I don't see right now?
No, none at this time. And please know that Casey's information is located in the back of her presentation, which are included in your summit packets as well. Casey, thank you so much. Thank you for sharing your story and how it, how it really, I guess, initiated this response and in your prevention efforts in your community. It's a testament to the work that you do. Just to your personality. You've been such a huge advocate, and ever since the day I met you, I've been so interested in the work that you do and just so appreciative. So thank you so much. And we definitely look forward to continue working with you. So, please know that just because, you're no longer in your role with the Department of Health, we certainly still see you as a huge advocate in drowning prevention, and we'll definitely continue working with you.
Thank you so much. And it's been an honor to be included in this, even with me not being at the health department. I left in good terms, and I work with everybody that worked within my program still. So I'm just looking to fill in the gaps and help whenever possible. Connie just wrote, what are your thoughts on door alarms? I think the door alarms are incredibly important, and I think that it's the second line of defense. We talked about preventing a drowning. First is supervision at all times, no matter Can you hear me?
You're back. We lost it for a second there. And I think we lost you.
Oh,
Now
We're
you're
hearing you.
back.
We hear you
I'm
now.
so sorry. I don't know. I'm like, did it just end because I'm talking so much? No, but Connie asked about door chimes, and I think that that's important. And actually, I think that door chimes are imperative because when caregivers in the home doing dishes, helping Johnny with home, it out. And so I think that supervision is key. Door chimes, fencing around pools, swim lessons, and CPR are the ways to prevent a drowning from happening. So I'm a huge supporter of door chimes. I don't know if I answered the questions completely, but that was it. But if anybody else has any questions, by all means, please reach out to me. But I thank you so much. It's an honor, and I look forward to working with you all in the days ahead.
Thank you so much, Casey. Thank you. And much like I told Becky and the other presenters today, we will continue to field any questions and send them your way.